Never sleep in this position after 60. It weakens your heart, brain, and spine. Have you ever considered that a single familiar sleeping position could silently weaken your heart, reduce oxygen supply to your brain, and place continuous strain on your spine every night? After the age of 60, the body becomes more sensitive to even small changes, and that includes the way you position yourself in bed. Many people believe that as long as they get enough sleep, the body will recover, but the truth is sometimes the complete opposite. In the next few minutes, I will walk you through 3 sleeping positions that most people over 60 maintain every night, yet are silently causing harm. And at the end, I will reveal the safest position to protect your heart, brain, and spine. Are you ready to find out if you've been sleeping the wrong way? 1. Sleeping flat on your back and its hidden effects on the heart and brain. Imagine lying on your bed, body stretched straight, arms resting by your sides, feeling so comfortable that you think this must be the best position for sleep. But have you ever wondered what really happens inside your body after 60 when you maintain this posture for hours each night? Many still believe that sleeping on the back keeps the spine aligned and the body fully relaxed, but the truth is far more complex. When you sleep flat on your back, gravity pulls the abdominal organs backward, pressing against the diaphragm, the primary muscle that allows you to breathe deeply. This effect is especially pronounced in older adults as the diaphragm and intercostal muscles have lost some of their elasticity. You might think this wouldn't have much impact if it only happens for a few hours each night, but the problem is that it doesn't occur just for a few hours. It happens for thousands of nights over decades. According to a 2015 study from Stony Brook University, sleeping in a side-lying position helps the brain clear waste products, including amyloid beta, one of the proteins associated with Alzheimer's disease, far more effectively than sleeping on the back or stomach. This means that if you spend too much time sleeping on your back, the brain's self-cleaning mechanism may become less efficient. Do you realize what this implies? Over time, your brain will accumulate more neurotoxic waste, and the consequences may not appear immediately, but once they do, they are very difficult to reverse. I once had a 68-year-old patient who complained of having to wake up 3 to 4 times a night to urinate, even though she tried to limit her evening fluid intake. When we investigated further, we discovered that she always slept flat on her back. Research from Nagoya University has shown that in this position, fluid that accumulates in the legs during the day shifts back toward the upper body at night, increasing pressure around the heart and stimulating the kidneys to produce more urine. This explains why she had to wake up so often, which disrupted her sleep and prevented her body from entering deep, restorative rest. The striking thing is that not everyone who sleeps on their back realizes their sleep quality is being compromised. You might think, I'm still getting a full 7 hours, but ask yourself, do you wake up feeling foggy, struggling to focus, or even more tired than when you went to bed? That could be a sign your brain isn't receiving enough oxygen or isn't being cleansed effectively during the night. This leads to a bitter question. If sleeping on your back, once considered safe when you were younger, carries such risks after age 60, could other positions that people often think are comfortable and good for sleep actually be even more harmful? And if so, we need to know sooner rather than later, before these effects accumulate into serious problems. 2. Sleeping on your back with existing respiratory or cardiovascular problems. Have you ever woken up in the middle of the night with a heavy feeling in your chest, difficulty taking a deep breath, and a heartbeat faster than normal? If you're over 60 and experience this, there's a strong chance that sleeping on your back is the hidden culprit. As we age, the heart and lungs no longer function as powerfully as they once did, and any added pressure from a sleeping position can force them to work harder than necessary.
While sleeping on the back might seem to allow the lungs to expand fully, in reality, gravity pulls fluids and abdominal organs upward toward the chest. In older adults, this can cause a condition called orthonepia, shortness of breath when lying flat. Can you imagine how it feels when your lungs are being compressed from the inside, making deep breathing more difficult? For someone with heart disease, this isn't just discomfort, it's a sign the heart is being placed under extra strain. The American Heart Association notes that most patients with sleep apnea experience worse symptoms when lying on their back. As the tongue and soft tissues of the throat fall backward, the airway narrows, leading to reduced blood oxygen levels. What do you think happens when this occurs hundreds of times in a single night without you even knowing? The brain and heart are forced to repeatedly startle awake to restore breathing, disrupting the deep sleep cycles essential for recovery. For individuals with existing circulation problems, this continuous drops in oxygen accelerate memory decline and weaken the heart. Remember, the brain consumes nearly 20% of the body's oxygen even while you're asleep. Cutting off that supply night after night for years is like forcing your brain to run on chronic fuel deprivation. Even more concerning, if you've recently had knee pain or suffer from chronic arthritis, as is common in this age group, lying on your back for long periods can further reduce blood circulation to the joints. This means the body's ability to repair and regenerate damaged tissue during sleep is diminished. Isn't it ironic that the very time your body is supposed to be healing could actually be the time it sustains more damage?
I recall a 72-year-old patient who told me she often woke up with her head feeling heavy, as if covered by a wet blanket, despite sleeping for 8 hours. When advised to try sleeping on her side or slightly elevating her upper body, her morning headaches decreased significantly within just 1 week. Have you ever tried making such a small change to see the difference for yourself? But if sleeping on your back can put pressure on your heart, lungs, and even your joint recovery process, is there a position that's even worse? The answer is yes. And what's more alarming is that this position is often perceived as the safest by many, especially when they want to feel snug, cradled, or fully embraced by the bed. So what is this position, and why does it harm your spine, lungs, and brain even more than everything we've discussed so far? 3. Sleeping on your stomach and the greatest mechanical risks. Have you ever felt comforted by burying your face into the pillow, wrapping your arms around the mattress, and sinking into sleep? For many, sleeping on the stomach feels soothing and can even help them fall asleep faster. But have you ever wondered what your body has to endure when your neck is twisted to one side for 6 to 8 hours straight every night? After 60, when spinal discs thin, joined neck joints stiffen, and nerves have less space to tolerate pressure, this position can become the single greatest mechanical burden you unknowingly place on your body. Picture this. To breathe while lying on your stomach, you must turn your head completely to one side. This compresses the blood vessels and nerves in the neck, restricting blood flow to the brain. What do you think happens if this supply of blood and oxygen is limited every night for years? At first, you might only notice a stiff neck or a headache upon waking, but over time, it can contribute to dizziness, memory decline, and even increase your risk of falls due to poor balance. A 2019 study from Osaka Medical Center found that people over 60 who frequently slept on their stomachs had significantly higher rates of neck or upper back pain, along with poorer sleep quality. When lying in this position, you're not only twisting your neck, but also flattening your spine against the mattress, erasing its natural curvature. The lower back is pushed into excessive extension, placing substantial strain on the muscles and ligaments of the lumbar region. Have you ever woken up with lower back pain radiating to your hips after a night of sleeping like this? For people with knee arthritis or degenerative joint disease, sleeping on the stomach can place direct pressure on the joints if the knees are bent. This not only intensifies pain, but also prolongs inflammation, reducing the joint tissue's ability to repair during sleep. Your body is trying to heal, yet that process is being blocked by the very position you choose for rest. Another issue, often overlooked, is that when the chest is pressed into the mattress, lung capacity becomes restricted, causing you to breathe more shallowly. It's like trying to inflate a bag that's weighed down. The lungs simply can't fully expand. As a result, oxygen exchange decreases, forcing the heart to beat faster to compensate. And all this happens while you believe you're relaxing. Isn't it contradictory that deep sleep could turn into a workout for your heart and lungs? I once spoke with a 65-year-old patient who said she felt comforted sleeping on her stomach, as if returning to her younger days when she hugged a pillow to sleep. But after switching to a side sleeping position supported by a body pillow, she realized she no longer woke up with a stiff neck or back pain. Have you ever tried making a small change to see if emotional comfort could align with physical safety?
We've just gone through 3 common sleeping positions that carry serious risks for the heart, brain, and spine, especially after age 60. But the biggest question remains: if lying on your back or stomach isn't ideal, which position actually helps you sleep well, protect your health, and wake up energized? And why have the Japanese maintained this position for centuries as a longevity secret? The sleeping position that protects the heart, brain, and spine. We began this journey with what seemed like a simple question: which sleeping position is safest for those over 60? Now it's time to keep my promise and close the loop we opened at the start. For generations, the Japanese have embraced a sleeping posture that protects spinal alignment, optimizes breathing, and promotes blood and oxygen flow to the brain. Side sleeping, especially on the left side, with the upper body slightly elevated and supported by a pillow placed between the knees. This position helps maintain the spine's natural curvature, reduces strain on the neck and lower back, and opens the chest to allow the lungs to expand fully. According to the Cleveland Clinic, side sleeping also helps keep the airway clear, reduces the risk of sleep apnea, and improves blood flow to the brain. For those who have experienced nighttime urination or difficulty breathing when lying on their back, switching to a side position with slight upper body elevation can significantly reduce these symptoms in just a few nights. I remember a 72-year-old patient who used to wake up 4 times a night to go to the bathroom. After trying the side sleeping position with pillow support, within just 2 weeks, she was down to only once per night and woke up feeling clearer in mind and lighter in body. Would you like to experience that kind of change in just a few days? If you're currently sleeping in one of the 3 positions we just discussed, try making the switch tonight. And if you've already adopted the new position, share your experience in the comments. Your story might just help someone else reclaim a healthier, more restorative sleep. Will you begin your journey to protect your heart, brain, and spine tonight?